Streaming live on WFLA Now.
And good morning, I'm Shannon Encino with WFLA, and I'm joined now by Mike Weiss, epidemiologist with the Hillsborough County Health Department. And if you saw us earlier, you may have seen Mike earlier on our newscast. Obviously, we're talking about measles outbreak and hepatitis A, which seem to have a lot of cases now in the Bay Area. So we just wanted to bring you in and get a lot of viewer questions. So please put your comments and your questions in the comment section below, and we'll go through this stuff. But first, Mike, so how scared should we be? Because we're hearing about measles cases, we're hearing about hepatitis A. What would you say?
Yeah. Well, good morning.
Good morning.
Happy Friday.
Happy Friday.
To be with you. So measles is a problem around the world right now. So we're seeing cases in many of the countries around the world that U.S. people like to travel to. So Israel, Brazil, the Philippines. And what we're seeing, unfortunately, is people travel there and bring measles back into the United States. And on top of that, you have communities throughout the U.S. that have pockets of unvaccinated individuals. And when measles is brought into those communities, it can spread very quickly. We've seen that in Washington State, California, in New York City. So we certainly are seeing measles kind of get back into the everyday in parts of the U.S.
What are the symptoms of measles that people need to look out for?
So measles is actually a respiratory illness, so it's going to give you a pretty high fever, cough, red, watery eyes, a runny nose, and then that quickly moves into having that distinctive rash, which is a rash that starts on the forehead and neck and moves down the body. And
then you're saying because of some of the unvaccinated things, when did this really start ballooning with the measles cases that you've noticed?
So really in the United States, we've seen cases really come back in high numbers within the last year and a half or so. And so it's unfortunately mostly fueled by these communities that do have high unvaccinated rates or low herd immunity in those communities.
And explain herd immunity.
Great.
People may hear this. What is? Yeah. Break that down for us.
So it's best kind of to do it through an example. So if we have an unvaccinated person that gets measles, they can often be contagious and be spreading that disease when they still feel okay. So they're going to go to the grocery store, they're going to go to the schools or work, and if they encounter people that are unvaccinated, they can spread it to that person, and then that person can keep passing it through the community. But if on the other hand, our sick individual goes to the grocery store, they go to the school, they go to work, and all they encounter are vaccinated people, the virus stops right there. It doesn't have the chance to spread through the community from one person to another.
And then often parents know that their children may be vaccinated because obviously schools, they have requirements. Mm-hmm. But a lot of adults, how do you know if you've been vaccinated or not? Or if you're unsure, what should you do as an adult?
Yeah, absolutely. So it can be a little tricky. There's a lot of kind of years and different types of vaccines that have been used over the course of trying to prevent measles. Really the best thing is to start asking some questions of your doctor. You can talk to them. They'll ask like when you were born. They'll look for your vaccination records. They'll maybe be able to look through your medical history to see if you maybe even had measles as a child or something like that. And then you can always just ask them to get another dose of the vaccine. It's the MMR vaccine. It's safe to get an extra dose, even if you maybe had it in the past. So when in doubt, you can just get revaccinated.
And we did have a question from one of our WFLA viewers about that. She had heard if you had gotten it before 1989, do you need to be revaccinated? But you're saying if you're unsure, you can ask.
Yeah, you can always just ask your doctor. They might choose to just give you a blood test that'll check for the presence of those antibodies in your blood, which means you either had the illness before or you've been vaccinated before. Based on when you were born and the likelihood of your being vaccinated might change what their decision is, whether to go through the process of testing you or just to go ahead and give you the vaccine.
Is there anything people can do outside of getting vaccinated to minimize their risk?
I mean, really, that's the bottom line is this is a virus that can spread pretty quickly in communities where we don't have that vaccine. uptake where we see low numbers of vaccine. It can spread very quickly. So really the number one thing, just go ahead and get yourself and your family vaccinated.
And then obviously in the Bay Area, we're familiar also too with a lot of hepatitis A cases, and we're hearing about them at several restaurants, and it's kind of making you wonder, things safe to eat. Can you talk a little bit about what's going on in Tampa Bay that you've noticed with the hepatitis A cases?
So we're definitely seeing an increase in hepatitis A in the Tampa Bay area. Hillsborough, Pinellas, Pasco County, really, the entire Bay Area is seeing quite an elevated number of hepatitis A cases. Now, when we look at it, our department is charged with looking at the information, the facts about the people that are getting sick, and we see that overwhelmingly these are cases that are occurring in the drug-using communities, specifically meth use. We're also seeing it in those that are struggling with homelessness, as well as people that have been recently incarcerated. That's the majority of our cases come in those high-risk individuals, and so our outreach, our prevention measures are all really targeting those groups, because we know if we can prevent the transmission, kind of like we talked about before, if we can really stop the spread amongst that community, we really prevent it from spreading out to the larger community as a whole.
And you mentioned that you investigate these cases. Tell us about the process. How does a health department go about this? Like, does someone just call and say, hey, I'm feeling sick? What's the reporting process?
Right. So what we do is governed by state law, actually. So by law, doctors and laboratories are responsible for giving us information on people that test positive for these diseases, like measles and hepatitis A. They're called reportable diseases. So those cases are reported to us. We start by thoroughly investigating, the information that we can get. So we look at those lab results. We look at the symptoms. We'll talk to the doctor that diagnosed the person to see if all that adds up to a real case. All these tests and things aren't 100%, so we want to make sure before we do anything and get out there that we are dealing with a real case. So we make sure that's the first thing we do. And then once we get that information, we really look at first how the person could have gotten it, and then who have they put at risk for spreading it further. And so with something like hepatitis A, we generally see that, when we ask that question, how did you get it, it's what we've talked about. They may have used drugs, they may be homeless and living in some unsanitary conditions, and then we're going to look at, can they put other people at risk? And so we're of course trying to prevent in all sorts of settings. We see that hepatitis A can spread in a household pretty easily, because you're sharing bathrooms, you're making food for your family, you're sharing household items. So we do make sure that we go ahead and get vaccine to everyone in that household that's been exposed. And then certain professions can put the public at risk. So if we do identify someone that works in a restaurant or in the food service industry, we want to make sure that while they were working, they didn't put the general public at risk for acquiring the illness. So,
and what are the symptoms of hepatitis A?
Oh, sure, absolutely. So hepatitis A is an illness that is going to start with kind of more of a GI illness. It's nausea, vomiting, diarrhea, abdominal pain. Then you'll usually get some fever, fatigue, and then really the hallmark of hepatitis is that jaundice. So you're going to get yellowing of the skin, yellowing of the eyes, some dark urine, clay-colored stools. And so it's a pretty serious illness, and those symptoms with hepatitis A can last for weeks, if not months, for some individuals.
We have a comment or a question from Victoria. She was kind of concerned about her young children. She has a 2-month-old or 3-month-old and a 2-year-old, and she's kind of afraid. It's also important to put this all in perspective too, about where are we at with hepatitis A, where are we at with measles. What's your kind of big picture as you're seeing all these cases in the country? Is there one you're more concerned about?
Yeah, so I mean, certainly right now we know we have cases of hepatitis A in our community, and we're doing everything we can as a public health department and working with all of our partners to prevent that from spreading. But we have a pretty good idea on where these cases are occurring. We are getting all the resources we have at our fingertips out to that community to do what we can to prevent it. So certainly for both of these diseases, the bottom line is they're both vaccine preventable diseases. We will recommend all the vaccines to any individual that is interested in getting them. Like we said, measles is a required vaccine for entry to school. Hepatitis A, though, is optional, so some parents may have chose not to. So it's just one of those things you can talk to your doctor about for your child, for yourself, and see if it's right for you.
One question we also just got in was, what's the medical treatment for measles, and what is the healing process?
So, unfortunately, with most of these diseases that are viral, it's really supportive care. Measles can lead to some pretty serious complications like swelling of the brain and pneumonia, and so those are things that they'll basically, once you have those symptoms, they will just treat what's occurring at the moment. So. There's a lot of misconceptions out there about like ways that they can treat with home remedies or even prevent the illness with home remedies, but the only thing that would really keep you safe and prevent you from getting sick in the first place is the vaccine.
And speaking of misinformation, talk about kind of the misconceptions about vaccines and what you really want people to know.
Yeah, absolutely. So bottom line is the thing that you might hear about the most with vaccines is that somehow it's associated with autism. And there's been no single statement that's probably been debunked more times than that. There's tons of literature now that supports giving the vaccine. It's completely safe, it's really effective, and it's really the best way to keep you safe. So there's no correlation between vaccines and autism. And then really some of the other things we'll generally hear is that they don't even work, or they're not going to really prevent you from getting sick. But all of the evidence that's out there shows that these vaccines are really good, especially the two we're talking about today, at preventing someone from getting sick. So the measles vaccine, over 95-98% effective when you have both doses, and the hepatitis A vaccine, same thing. It's 95% effective at keeping you healthy.
And talking about trying to debunk some misinformation too. So again, can the vaccine cause measles? Can the vaccine cause?
So the measles vaccine is actually kind of a live vaccine, but it's a modified strain. So if you get that vaccine, there is a chance that you have a very mild reaction to it, because that's the point. It's eliciting this response in your body. You're supposed to respond to it very slightly. And so we do see that some people get some soreness, some, kind of the site that they got the vaccine, they'll get a little bit of soreness. And sometimes, a very low percentage of the times, they can get kind of a mild rash based on the vaccine. But still, nothing like the actual illness itself. The illness is really bad and very severe. The side effects are pretty low and pretty mild. And
just because again, we're going through the questions, and we seem to have a lot maybe who've checked in a little later, who are adults. They know, yes, their kids have been vaccinated, but they may not be able to remember what are the steps they should take again.
Yeah, no problem. So number one is see what you can find, what evidence you might have of having the vaccine or having had the illness before. So it's worth just checking in with your doctor to see if those things are documented in your medical record somewhere. Next, you can ask about possibly getting a blood test that would check for whether you have those antibodies in your system that show that you've either had the vaccine or the illness before. And then probably the easiest option, just go ahead and ask to have the MMR vaccine again. It's completely safe to get another dose of the vaccine, even if you maybe had it in the past.
And then finally, too, the different county health departments, if people want to contact you, what information can you provide? Like the resources for people who live in the various counties too.
Yeah, so absolutely. Our health department is more than willing to talk to individuals if they have questions about the vaccine, if they have questions even about what's going on in the community. They can always reach out to us, and we have people that are specialists in vaccines that they can talk to. We have people that are specialists in my team in the epidemiology department that can talk to you about the diseases that are going on in the community. So by all means, if they would like to reach out to us, they can give us a call.
And then for anyone who doesn't know what an epidemiologist is, what do you do?
So we are charged in basically investigating cases of infectious diseases. So we are disease detectives. We're going to keep track of diseases as they spread through the community with our goal to stop their spread and keep people healthy.
Well, and again, Mike Weiss, thank you, epidemiologist from the Hillsborough County Health Department. Thanks for joining us.
No problem.
And if you missed the start of it, obviously you'll be able to view it again soon. So thanks for joining us, everyone.